Jim Sandin is doing prayer, Bill Ralston pledge, David Wyland four-way test, and Larry James will be doing the singing today.
Please bow with me in prayer. Father in heaven, we are grateful to you for the blessings of life that you pour out upon us, for the food we enjoy, the fellowship we have, the opportunity to serve you and our fellow man. We pray you would bless our efforts in Jesus' name. Amen.
Amen. Please join me in the pledge to the flag of the United States of America.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Join me in reciting the four-way test of the things we think Sarah do. Number one,
Is it true?
Number two,
Is it fair to all concerned?
and number three,
Will it build goodwill with better
and
friendship?
last number four.
Will it be beneficial to all concerned?
I was checking to see who was reading and who was just nosy.
All right, it's December, the last year of this, last month is here. Do you have a birthday?
Let's see.
Please join us up front.
Today,
And if you don't know, it's on that list if you can't remember when your birthday is. And for those of y'all that don't know this song, oh my God. Only 2 people today? That's great. All right. Oh, yes, you are. Ready? Happy birthday to you. Happy birthday to you. Happy birthday, dear Ray. Happy birthday to you.
For both yeah, maybe 30. Wait, no, I don't want to go back to 30. I like my 40. Okay.
Your mic's on.
Yeah. Yes, it is.
There it does.
It's on. Okay. I'm just too tall for this mic. Okay. Let's see. We are going to move on to Happy Bucks.
Happy Bucks, who's happy to be here today? Prove it to me. Prove it to me. You get to go first today. Oh, I get it.
Well, I got it.
Here you go.
Okay, I have a happy buck today because I want to remind everybody that I'm having my big party at my office tomorrow. Between 4 and 7, I hear this big banquet going on tomorrow night. So you still have time, since I start early, you still have time to swing by my place and have a glass of wine and an appetizer, okay? So you get ready for the party. Thank you.
All right.
8, 9, 10 was-
Larry's anxious. You gotta say something.
I'm just happy that Christmas is almost here so it can be over and I quit hearing Christmas songs.
Oh, okay, moving over here, Debbie.
I've been going on in my house and in my
Here you go,
for
Debbie.
6 months.
I don't know if $1's enough. If I have to dig out another one, let me know. But I want to say thank you to Rich Carter and Hunt Regional Healthcare for the awesome business before hours yesterday. The food was delicious. You picked the best caterer. We appreciate it. You did great. It was nice to meet Dr. Wrangler, and I guess we'll maybe hear more stuff of that. But then also, we had a ribbon cutting at Texas Gold Connection. You guys, they've been here for 38 years. Family owned, operated, costume. They'll make anything you want custom. I mean, they'll make anything that you want. They said take a picture and they will make it for you. But I got so lucky, I left early and I won the beautiful Texas heart necklace, sterling silver. It was gorgeous. I just want to tell y'all how blessed I am. And then if I owe another $1 later for this, I'll let y'all know.
But she's not from Texas, she's from Oklahoma. So I said, give it to me.
You had another ribbon cutting yesterday, too. Yesterday morning.
Oh yeah.
At Cold Brew at the hospital, the new coffee shop that's going to be fantastic.
Yay, yay.
Here's the rest of the money for Debbie's thing. Gloria's on vacation in the Bahamas, and I'm on vacation in Texas. We're both having a good time.
Very good. All right, I'm moving on. Nobody's happy over here. Oh, well, Roxanne's happy.
Birthday girl.
I'm happy to see y'all for my birthday. Thank you for singing. And I'm really excited about being able to go on the cruise to the Rotary cruise to Cozumel.
Oh, thanks.
Very nice, okay. Thank you, guys. Everybody okay? Oh, Larry's got something. Oh, you're good. All right. Oh, moving around. I'm going to move around this way. Okay. Here.
This is just kind of a last ditch chance. If anyone wants to jump on that cruise or fly down to Cozumel, it needs to happen pretty soon. Quickly.
We
And
have
we'd
how
love to
many?
have y'all.
We have how many altogether going right now?
We have 8 on the cruise ship and 5 flying. So we've got a good group.
Katie, I see that $1.
2.
Ooh, 2.
I am extra happy today. I'll use this one.
Okay.
I'm extra happy today because Saturday is the last day of Medicare open enrollment season. Yay! I'm exhausted. It's been a blessing. It's been great. Okay, that it? Let's move on to
That's it, Les.
Decadestiny.
Anybody else got anything else? Let's have a drum roll. Okay, you're gonna have to say these numbers slowly and loudly.
Let me hold that over here.
859 455.
155.
That's mine.
That was good.
Double check here. We need an auditor. I don't think I've ever. That's all right. All right.
That's awesome. You're about to drop a ticket out of your pocket, too.
Pull all the other cards out of your pocket.
You want to cut these?
There you go. Cut
We
them.
like playing poker over here? Right. I mean, it's serious. Shuffle them real good.
They shuffle good?
You want to
Yep.
cut them again?
As if he gets the ace of spades, he wins.
Top one. Cut for luck.
He's drawing the bottom card.
Wait, we got to tear it.
Okay, I'll tear it. That one's gone.
There's not many cards left.
Just so you know, that was $805. Next week, somebody's going to get it for sure.
Okay.
Back to you, Katie.
All right. I would now like to invite Dr. Michelle Baird. Is she here? Okay. And you are presenting the Teacher of the Month, correct? Yes. Come up here.
Yay.
Let me have yours because that one's not.
Yeah, that's not working.
Well, first of all,
No, that one's not working now.
It was.
Okay, first of all, I'd like to say thank you so much for having us today. We're honored to be here. I'd like to present to you Miss Josie Luna. Miss Luna graduated from Texas A&M Commerce in December of 2014, magna cum laude. She's very smart. She began teaching in Greenville in 2014 as a permanent sub at LP Waters, the Early Childhood Learning Center. And she is certified to teach early childhood through 6th grade, and she also has her ESL certification, which means that she can work with our English as a second language students. She taught pre-K-4, which are our 4-year-old babies, for 2 years, but she then moved into the pre-K-3, working with our 3-year-olds, and that's what she's been teaching now for 4 years. She taught summer school for 5 years, and she loves doing that. But she's also a huge team player just for Greenville ISD as a whole. She tutors 5th grade students at Lamar and at Carver when it comes time for us to do interventions for those students. And so she's just a great asset to LP Waters and also to the district as a whole. So I appreciate y'all having us, and I'd love for you to just welcome and honor her today. She's thought she was a student? Well, that's why we have to keep her an LP, so that everybody knows she's not a student.
Okay, you stand right here next to Miss Baird, and from the Rotary Club of Greenville, I would like to present you with this, the Teacher of the Month Award. Congratulations.
Thank you so much. Thank you.
That's what we love hearing about our great teachers in GISD. I would now like to invite up, we have a student of the month here, correct? So I would like to invite that student of the month, but I would also like to invite a Rotarian up as well. Of course, he's Jarvis, but Miss Debbie Sickles, would you please accompany Miss Jade Sickles?
So sweet.
Yeah, it makes you sound like he's in trouble.
This was a surprise. A very pleasant surprise.
Okay, our student of the month is Jade Sickles. And let me tell you a little bit about Jade. She went to school most of the time of her life in Greenville schools, but she did spend a little time in Oklahoma. We got her back. And she participated in volleyball and softball for us. Not track. Well, I asked her to. She never ran track for us. Volleyball and softball. And some of these kids, I'll ask them to brag about themselves. And she didn't give me anything. And so I had to go by my memory of what she has accomplished. And one of the things I wanted to say, as a coach and now as a principal, it's very few times that you get to see an athlete who can take control of the game. When the game's on the line, they just take control and they dominate. This one right here dominated her senior year as a volleyball player. When those games were tight, they needed somebody to score, this was the one stepping up and scoring. And so with that, she led this year's team to district championship and area finalists. As a junior, they made the playoffs for the first time in a long time. And along those lines, she was honorable mention as a sophomore all-district, first team all-district as a junior, and this year, she was named MVP.
Yes.
As well as being named to the All-Star, the Girls Coach Association All-Star team. She played on that team this past summer. And I'm going to let her tell you what she's going to do with the rest of her career. Because of all that, she is pretty good and she can play at the next level. So, where are you going to play?
Commerce, Texas A&M Commerce.
All right.
And what are you going to major in?
Kinesiology.
And she's got her parents here, Gary Sickles and Jenna Sickles, and her mother was the coach of that district championship team, so she's over there. So you're going to grow up and be a
coach.
Congratulations, Gary Sickles.
Can I get Gary and Jenna up here too?
Yeah, y'all, the whole family.
The whole family. If Papa wasn't in Amarillo, we'd have got him here too.
And I just want you to know, volleyball was my favorite. That's what I played. Back a long time ago before the Libero or whatever that thing is. I know.
That thing she was. For a while.
So, Jade Sickles, y'all come forward.
That's it, family. I didn't know.
This, the Rotary Club of Greenville would like to present this to you, the Student of the Month Award. Very awesome. Love the volleyball players. Okay, I have some money that I would like to give away because, you know, that's what we love to do here. So, Bert, where is he? Come on up and let me give you some money, honey. Okay, so every year in our budget, we make sure to include community seeds because we actually, absolutely love what you do. We love what you represent. And I hear there's great things afoot at Community Seeds. And in just a minute, I will, go ahead and give you this mic, and you can tell us whatever you want to say. But I really, really appreciate everything you do for our community, and I am beyond blessed to be able to give this to you. So let's do this first. Woo. Got it? Okay.
Oh my goodness. David told us it was only $25.
And you paying for that?
Hey, on behalf of Community Seats, those that we serve, our staff, our administrative folk, thank you. You've been a blessing to us for a very, very long time now. I can remember back when Bill Ralston didn't like me, so I'm glad to come.
No, that's not even fair.
I'm glad I can come the day when he's actually inviting me to his church to speak, so that's pretty cool, Jim, right? Listen, I understand y'all got a little deal coming up tomorrow that serving wine. If y'all just bring a little wine to our place, it's okay too, okay? All right? Nobody's the preachers aren't laughing at that at all. It's being sarcastic. We're gonna welcome you tomorrow. A lot is happening with Community Seeds and those that we serve in 3 counties, Hunt, Range, and Hopkins counties. You're gonna get a double portion of this because you'll hear it again tomorrow. But not only is our incubator kitchen, praise God, about done, thanks to the USDA, the Greenville Follies, and Atmos Energy, and the Beach Foundation. It's almost done. We've got a floor that we're putting in. But also, right next door to our new office, we have a new office building that we're remodeling that is going to be a neat place that makes us visible right on Highway 69. We just bought another house for people who live in, so we have 4 houses now that we have. People live in for free as long as they stay attached to our program, our educational program, our Christian educational program. Dads must work, etc. But recently, and the only person who probably knew about this in advance was Rich Carter and maybe David Weiland. Recently, we were blessed to purchase a 30-acre ranch, a little less than 30 acres ranch that we're now going to be doing what we call a Freedom House. It's a rehab facility for men. Well, they'll be in residence for 6 months to 1 year. And we're going to change their lives totally by the Word of God and the disciplines that they'll be taught, and by good work ethics. We will start off with a population of about 12 men. We're duplicating something called the Denton Freedom House over in Denton, Texas. To get this done, we had to work with some great partners, one of which was Ridgecrest Baptist Church, as well as the Hunt Baptist Association. And we were blessed to raise an incredible amount of money in a short period of time to get this done. But we think it's necessary. Our churches have appealed to us for years about a place where we can take some of these men off the street, out of their addictions, and actually work with them firsthand, in front of them, in a close environment, that we can hopefully make a difference in men's lives, to make our men stronger, better prepared for work, as well as for our churches, and most importantly for their family, including their children and their wives. I told Connie Pettit over at Women in Need today that her job's going to become a lot easier, because we feel as though less women want to go to Women in Need if they have husbands that'll take great care of them, and that's what we're going to be developing. So, listen, you all have set a very high bar for us and your moral standard and things that one should think, do, or say. And we've tried to make that our standard each and every day at Community Seeds and in my personal life. So I personally want to thank you for that and for your support. Look forward to having you tomorrow night. You're going to hear a lot more. We have 2 bands that'll be playing tomorrow night. Our artists will be back. And of course, you'll get a report from Community Seeds, some of which you've already heard. But thank you. God bless you. And I'll give it back to you.
Thank you so much. Okay, I would now like to invite Sonia Cathy to come up. She will be introducing our presenter today.
Thank you very much. Thank you all so much for having us. You guys are always so hospitable and such a wonderful group that we can tell do so many wonderful things for our community, so that's awesome. So we're excited to introduce to you today our new orthopedic surgeon. His name is Michael Johnson, and he actually came to us from Mount Pleasant. So he's from the area. He started about a month and a half ago, and he came in rocking and rolling. So we're super excited of everything that he's already brought to our community. He's going to share with you guys today a lot about just orthopedic things. Feel free to ask questions. You should have been given a brochure, one with all of Dr. Johnson's information on it. And then the other one is a complete description of our growing Hunt Regional Medical Partners team. And on the inside, you'll see all of our family practice that we have within several surrounding communities as well as Greenville. And on the back side, you'll see all the specialists that are available at Hunt Regional Medical Center. We're so proud of the fact that you guys can have your health care right here within our own community, avoid those drives, and it's quality medical care. So, without further ado, please welcome Dr. Michael Johnson.
All right, well, I'm going to talk a little bit about who I am, and as Sonia said, I came from Mount Pleasant, so not too far down the road. My wife, Michelle, and my two sons, Cody and Owen, will be relocating here with me. We actually were supposed to close on the house we were selling and buying yesterday, and that fell through as of Friday last week, so we're still kind of in the process of getting transitioned here, but I am here full-time, Monday through Friday. Board certified with the American Board of Orthopedic Surgeons. I'm a general orthopedist. I do a little bit of everything in the scope of orthopedics, including sports medicine, adult reconstruction of joint replacement, arthroscopy, both non-surgical and surgical care of orthopedic problems. As far as sports medicine, that's kind of been always one of my passions, and have been involved with that really my whole career, between high school, college sports, several rodeos. I've always been involved with that. Took care of a couple of collegiate teams when I was in San Angelo and then in Mount Pleasant. And I took care of the San Angelo Bandits, which was a semi-pro arena league football team. So initially I actually went to Stephen F. Austin and got a degree in agriculture. And I kind of did a little hodgepodge of different things for a while and decided that I wanted to become an orthopedic surgeon. So I went back, got a second degree from UT Arlington, and ended up doing all of my training in San Antonio. So went to medical school and did internship and residency there. I'm board certified, a member of the American Academy of Orthopedic Surgeons and Texas Medical Association. So this is a little bit about me. So why see an orthopedic surgeon? I would say by far the most common reason is people are in pain, and most people don't like pain. They want to be able to increase their mobility and get back to work, get back to sports, get back to all their normal day-to-day activities. So we're going to talk a little bit about joint pain and then kind of focus on some of the more common issues that we see. The Centers for Disease Control reports 14.6 million people have severe joint pain in the U.S., so it's a very common problem. When we talk about knee pain, I mean, this can be from just a little sprain or strain, or maybe some overuse. It can be from an injury, arthritis. People ask me a lot, and they blame it on just getting older, but I mean, getting older doesn't necessarily cause pain, but as you get older, you're more likely, of course, to get arthritis. So when do you need to see a doctor? I would say anytime you have pain would be a time to see the doctor for it. And it may be something minor, but it's always good to get checked out. And like I talked about, there's a whole slew of different things that could be causing knee pain. It could be tendonitis, runner's knee, or meniscus injury, arthritis, sprains. So how can we help? We typically start with history, physical, x-rays, Sometimes an MRI can show us things that an X-ray can't show us. And a lot of that determination is based on what we see on X-rays or on exam. Usually we start with that, come up with a diagnosis, which helps us come up with a treatment plan. So we'll talk a little bit about knee replacement. Of course, not everybody with knee pain needs a knee replacement, but this is a procedure that is for a worn out knee, basically. So when you've got arthritis and we've done everything else we can do and you're still having pain, then knee replacement may be the answer. So there are different types. There's partial and total knee replacements, basically. So if you only have one part of your knee that's affected, sometimes we can do a partial replacement. By far more commonly, it's going to be a total knee replacement. So people always ask about recovery time, and I think that depends on how you define that, but generally we try to get people up out of bed, get them walking day after surgery. Most people, somewhere between 6 and 12 weeks is the time frame where they're really getting around well and starting to feel like it's better. A lot of people put this off because of a variety of reasons. I think a lot of times it's fear. They maybe knew someone or heard of someone that had some kind of complication or didn't maybe have a good outcome. So, a lot of times it's giving them the information we have, studies that are out. We can kind of predict that the prognosis is very good for most people. I just saw a guy yesterday that is about a year away from retirement, so he's trying to continue with conservative treatment until he retires, which will be a better time to do a knee replacement. So there's a variety of reasons people put it off. The patient examples, like I said, the guy yesterday, and we can do injections, and this particular patient had excellent results with injections. We'll continue to do that for the next year until he's ready to have a joint replacement. So hip replacement. I didn't really mention when we were talking knee replacement, but basically the joint replacements consist of metal and plastic. So hip replacements, similarly, it's done for the same reason. When you have an arthritic hip, worn out joint, and we've done everything we can do conservatively, then it's time for a hip replacement. So again, we can do partial and total hip replacements. Normally for arthritis, I would say pretty much exclusively we're going to do a total hip replacement. It's very common to have to do a partial hip replacement on elderly patients with certain types of hip fractures, and that actually allows them to get up moving faster than if we were to try to fix it without some of the risk of complication of that fracture not healing and whatnot. Recovery time, similarly, with pretty much any joint replacement, the idea is to get up and get moving as quickly as we can. And I'd say it's maybe even a little easier for hip replacement as far as recovery. I think patients maybe tend to have a little bit less pain, and the range of motion is not really as critical with a hip as it is with a knee. So I think maybe they even recover a little quicker and easier with a hip. And again, people put it off for the same reasons. Maybe fear, maybe timing. So a good example of this, I always give this as an example. We usually think about this as a problem with older patients, and normally it is. I had a patient that had basically like a bone disease. It's called avascular necrosis, where the bone in the head of the femur, or the ball of the ball and socket joint, dies, and that causes the joint to collapse and get really severe arthritis. So this guy was 29, and we had done everything that we could do to try to salvage his hip, and it just got worse and worse. Ended up replacing his hip at 29, and then did his other hip about a year later. And he's a farmer, rancher. That's what he does for a living, and a big guy. He's like 6'8". So I was able, this guy was pretty much on a walker at 29 years old, and has both the hips replaced. Unusually young, but he's back to farming, ranching, baling hay, and doing all the things he does. So shoulder replacement, if we're seeing a theme here, it's pretty much the same thing. And again, this can be done for certain fractures. Sometimes when an older patient has a fracture and it's just too broken apart to really repair, a replacement can be the answer. And also very commonly done for severe arthritis. So when talking about types of shoulder replacements, again, this can be partials, totals, most of the time totals. And you may have heard of a reverse shoulder replacement. So what that is just a different type of implant that kind of affects the center of gravity or the center of rotation of the joint. And that is designed for someone with severe arthritis with a deficient rotator cuff. So if they've got a chronic rotator cuff tear that can't be fixed and they've got arthritis, this is a special type of implant that can be helpful for them. Same reasons people put this off. As far as patient examples, one that I can think of, a lady who was a art professor when I was in Mount Pleasant, who had severe arthritis of her shoulder, and again, we had done injections. This thing's just going on its own. But, anyway, failed conservative treatment, and she was having difficulty with her job because of having to, painting and as an art instructor, it was her shoulder motion was so limited that she was having a hard time with that, and we were able to get her back to being able to do that. So I'm not sure why this thing's just going. Not pushing the button. So we'll talk a little bit, kind of shifting gears into sports medicine. So with a little more focus on our younger patient population typically, we are kind of collaborating with sports, with schools here in the area. That's Dr. Witherspoon on the left.
Oh, Lord, it's possessed.
I'll just keep talking. Dr. Witherspoon is a family practice sports medicine specialist, so he's a family practice doctor, doesn't do surgery. But this is a great partnership that we're able to have because he's able to kind of extend the accessibility of care for these athletes. So he and I are both on the sidelines with the athletic trainers, and when the student athletes get injured, we're able to get them in as quickly as possible, get them worked up and treated. We have kind of established relationships with the athletic trainers, so they have direct access to us pretty much 24/7. Trainer calls me and has a kid he wants me to see, then we get them in and get them seen. And so we've got it. Dr. Witherspoon is taking care of, he's in charge of the concussion management program at Texas A&M Commerce. So that's kind of something that is really more on the family practice, non-surgical side of things, of course. And we're also working with Greenville, Cattle Hills, Commerce, Lone Oak, and Wolf City, and trying to really make sure we take good care of our athletes in the area. So let us keep you doing what you want to do, try to keep you active, and the idea is get pain relief and keep going with life.
Yay.
So I'm sure there will be some questions about the Mako, and I'll be happy to let everything talk about that.
What are the components in the shoulder replacement?
Pretty much with all the joint replacements, we're talking metal and plastic.
No, I mean, what bones are involved in the?
It's going to be the humerus, the ball, and the glenoid, which is the socket, which is part of your scapula, shoulder blade. So we resurface the ball and the socket typically. With the reverse, your arm's not going to be turned around backwards. Basically, it means that we put the ball on the socket and then put the socket where the ball used to be, so it sort of changes the center of rotation.
Do you hear, I've heard this a lot, that shoulder surgery is more painful than any other joint, and why would that be?
Well, Yeah, I agree, and probably knees and shoulders, I would say. And that being said, there's really good multimodality pain control that I think it's easier to go through now than it was probably 15 or 20 years ago. The nerve blocks that anesthesia can do work wonders and really have helped us cut back on the amount of narcotic medication we have to prescribe.
Dang it, I wish you had done mine then, because it hurt like crazy, so.
Yeah, shoulders are supposed to be pretty painful, but I think it's because your shoulder is probably the most mobile joint in your body, so it moves more than anything else. And you know, similarly with your knee, we want to get that range of motion early, so you know, there's a lot of movement when you got that big incision right in the front of the knee, so those tend to be more painful than hips. Yes, sir.
I hear about the danger of blood clots in knee surgery. Why is knee surgery more dangerous than others?
Well, actually, knee and hip surgery both have a risk of getting blood clots, and we routinely prescribe blood thinners to prevent those. So for knee replacement, it's typically about 2 weeks. For hip replacement, it's about a month. But there's a whole, that could be a whole discussion on what to use and how long, but you know, now we have oral medications that don't need blood draws, and you know, like with Coumadin, you have to get your blood drawn. Other medications have to be injected. So we have several different medications to choose from that are very effective, and it's pretty rare to get a blood clot with appropriate medication to prevent it.
Are you replacing ankles here?
No, that's really a pretty specialized, that's going to be mostly your foot and ankle specialists that do that. Now, I don't know if Dr. Brancho and the podiatry people are doing any ankle replacements.
No, they do.
They do.
You may, go ahead.
I was curious what injections you give, because some people only do cortisone, but you
Right,
do
right.
the other injections also?
That's a great question. Yeah, cortisone injections are again, the most common and probably most likely to be effective. There are also viscosupplementation injections, which is high hyaluronic acid. Some people call them rooster comb injections or gel injections, a lot of different names, and there's a lot of different brands. Those work entirely different. It's supposed to be kind of almost like a lubricant for the joint. They're supposed to have some pain relieving effect as well. When you look at all the studies on those, I just got through going over the Academy of Orthopedic Surgeons. They have a kind of a panel of recommendations for knee arthritis, and they actually do not recommend those anymore. I still offer them. I've seen enough patients that some of them tell you that's what works best for them, and if they feel like it's working for them and they want it, you know, we have that to offer. And I usually have that discussion with them if it's the first time. You know, hey, it's, you know, the studies are kind of not real supportive of this, but some people find it to be helpful.
Anybody else? Have you noticed CBD oils adding any benefit?
I haven't really seen any studies or anything as far as to be able to answer that scientifically. I get a lot of questions about that now, and I have seen a lot of patients that kind of swear by that too.
Hey, even if it's placebo, it works, right?
Yeah, maybe.
Anybody else?
Take a minute and talk about the Mako robot for a second and the differences and the benefits.
Yeah.
So the Mako robot is it's been around for several years now, and initially this thing was designed for partial knee replacements, which have kind of been reinvented a few times over the years. People were trying to do partial knee replacements, and then, you know, through the years, the outcomes are not that great. So that's kind of where this developed, and now it's being used for partials and totals, and even for hips. It's a robotic assisted arm, basically. The robot's not doing the surgery, the surgeon's still doing the surgery, but the robotic arm allows very precise bone cuts, basically. So we can go in there sometimes with a little bit smaller incisions, particularly if it is partial, And the robot will basically not allow you to resect or remove bone from where it's not supposed to be. So it's a very precise way of removing the bone, and it's really the same operation. It's just that it's a different way of doing it with hopefully better precision. And the traditional way of doing that, I mean, you're not just going in there and just cutting bone, but we have cutting guides and jigs that are sized, you know, for a patient, and you go in there and kind of, you know, size it and cut bone as you go. With this, there's a little bit more preoperative planning and a little bit more precise cuts is what we're going for. Which, you know, translates into better outcome in the end.
Did you use that in Mount Pleasant?
No, we didn't have that in Mount Pleasant. And I've used a different variety of computer-assisted, you know, CT guided, different things. And this is something new for me. I'm actually leaving tomorrow to go to Florida to be trained on this. So it's, you know, it requires some special training and have to be proctored on 5 cases afterwards.
For some of us that's already had a knee replacement at one time or other, including myself, the only thing that we noticed about it really is that it's, you know, it's not too big. You can tell that right away. And for one thing, for us old guys, you don't get down on it on your knees either. It doesn't work. You know, but I guess that's just part of the problem.
I've said this about 1 million times, but I say it ain't what God gave you, but it's the next best thing. So, yeah, you're right. At kneeling, and I usually tell people that, you know, it's not that you can't do it. It's just probably going to be uncomfortable.
Right.
You know.
But I had to have it done though, because I had so much pain, it had to go away.
Right, and you could probably walk better and do most of your normal.
I still don't run though.
No, it's really not.
Well, you never did that before.
I don't either.
Thank you.
All right, thank you all for having me.
Thank you.
I've had 5 knee surgeries, so I'm sure another visit is in my future. Okay, I just have a couple of very quick announcements. First, I would just like to thank everybody who not only participated and helped, but also the Rotarians that came and wore your t-shirts to the Business After Hours event. It was amazing. It was beautiful in here. The Chamber of Commerce, Deanna Bird at the Chamber made it look fabulous in here. And so I just thank you all so much for being here and being a part of that. The next event that we have coming up is the Christmas party. Invitations have been mailed out. So I noticed that some of you have your office address listed as the address where I was sending the invitation. So for those of you that the invitation goes to your office, please make sure to take it home to your wives and husbands so that they can see it and know about it. We would like, number 1, an RSVP as soon as possible. Bill will need a head count very, very soon, so please RSVP to me. You can text me, you can email me, whatever. Just let me know if you and a spouse or significant other are going to make it to the party. The other thing concerning the party is we are again going to do what we did last year and ask you to bring a gift card to come and have it at the party, because we are going to be giving those to CASA. Last year, I want to let you know the impact that those cards had. It was really amazing because CASA, you know, we're adopting kids and giving toys to the kids that are already on their list and helping support those kids. But do y'all know how many kids they'll get in to the foster care system between now and Christmas? So that helps them to buy gifts for the kids that come in suddenly that are right there at Christmas time. And it was a huge blessing to them. So please make sure to get Walmart gift cards or Target gift cards or something like that and bring it to the Christmas party with you. And that is all I have for today. Oh, I did see Colleen, the community service list. Please make sure to fill out the community service forms that are on your table. All right, that's Rotary for today.
This video has been brought to you by Juice 34. Juice is your community-owned provider for electric, internet, cable TV, and true local programming.